I know I like to do videos that are hopefully funny, but this is going to be one very serious, and how to protect your dog if your dog has the signs of lymphoma. Uh, I've assembled all the information I could find from different websites, so here we go. First, lymphoma strikes quickly, and it's a very big reason that dogs die is because they're too far progressed. Just put your hand under your dog's jaw and feel around for the lymph nodes that are right here. We have them too as humans. And also check his back legs. Lymphoma, when it starts to take hold, the lymph nodes will grow in size rapidly. When it reaches that stage, your dog might only have 4 to 6 weeks to live. Now, and then he will die. It'll just be bam, there it is. The oncoming symptoms will be your dog is sleeping too much. Your dog is kind of listless, or he gets up in the middle of the night and just walks around and stuff randomly. So check his jaw, check his rear legs, and see if you feel any nodules. They feel almost rubbery. And in our situation, Wally's lymph nodes were like the size of golf balls. There's two of them, one on each side of his neck, and I could feel them. So it's not something you wait on. I went right to the emergency room. You have to go to a pet hospital. The normal situation at the vet's office won't help. They'll just refer you to a hospital. So go to a hospital. Tell them that your dog's got enlarged lymph nodes. They're going to immediately suspect it's lymphoma. Then you have two options. One is a steroid called prednisone, and if you take it, it's the least expensive option, and it could extend your dog's life another month or two, and that's it. There's no coming back from prednisone, because if you have your doggy take that steroid first, it will make the chemotherapy. Prednisone will make chemotherapy basically immune, so that when they do the protocols on it with all these different drugs, and I forgot the name of it, but there's a protocol of drugs. Prednisone wrecks all of that. So you don't want to be taking prednisone if you're thinking about doing chemo unless your vet tells you to do that. Now in our situation, it was called for. They did the prednisone first with the chemotherapy panel following right after that. So if you do the chemotherapy, obviously a lot more expensive. The interesting thing about dogs is that they really don't react to chemo like humans do. And only when Wally got the very large doses did he sleep around much. But he did not, really show much of the effects, other than he would seem very lethargic and drugged. But then by the following day, he would be bouncing back again. Another early warning that lymphoma is on the way before the lymph nodes swell is your dog, when he tries to lay down, will start to whimper. Our dog was doing that. It was like, And I thought, why is he doing that? But other than that, he was normal. And the problem is that lymphoma is a silent killer. It's a disease of the immune system and the lymph nodes that are within your whole body, like we have, that filter out and keep your blood clean. If you get cancer of that, the body then loses its ability to purify itself and clean itself. And the lymph nodes themselves, I think, just collect a lot of bacteria and gunk, and that's why they grow in size, because they're functioning. But your immune system is deteriorating. The doggie's immune system is deteriorating. And if you elect chemo or prednisone, remember, the only thing that they can hope to achieve with chemo is to it'll put the cancer in remission right away. It'll fire up the lymphatic system. But there's no guarantee that it'll actually stop it. It won't cure the cancer. You might get 2 years. Now, in dog life, that's a long time, because that could be another 12 to 14 years in terms of human. We got about 10 months extra time with chemotherapy. And during those 10 months, Wally had a really, really good life. We gave him a special diet. We made sure that he didn't drink tap water. We gave him regular bottled water out of sparklets. Just made sure all those little things were done. Now, let's talk about end of life, because it's the most horrible decision you're going to have to make, and you're going to have to make it if you're a pet owner. There's different schools of thought. I'll give you mine, of course. One school of thought is that when do you know when it's the end of your doggie's life? Well, you could allow him to die naturally, and some people do that. And I'm not going to cast judgment on people, because there might be different reasons. But generally, no matter what they tell you, lymphoma is painful. Cancer is painful. Wally not only had lymphoma, but he started developing other forms of cancer. And when the body breaks down, you're going to notice things. First of all, your doggie is going to stop eating. He won't eat his favorite foods anymore. He'll stop drinking. He'll actually refuse water. He'll turn his head away. He won't let you pick him up. He might even snap at you because it's painful. His stomach or his chest cavity could be painful. He's not biting at you because he's mad. He doesn't have any other way to communicate. And it's not like he's actually going to bite you. He'll just kind of go like, hey, please don't do that. When you choose to allow your dog to die a natural death, that obviously is the cheapest way to go. But I would ask that you first speak to the vet about pain medication. There's different types of pain medications they can give your dog. Now, I can't recall the name of it. It started with a G. But there's a panel of drugs they use for lymphoma, so it's not like I have to know the name right now. It goes from 100 to 400 milligrams, I guess, based on the size of the dog and the severity and the lateness. There's 5 different stages of cancer. The pain meds were the biggest thing. When you reach the pain med stage, it's called palliative care, Palliative. Palliative care is kind of like hospice for the dog. At this stage, the inevitable is coming, okay? So you want to make your doggie as comfortable as possible. That means having food nearby, the water nearby. He doesn't have to walk very far. But if you're going back to his cause of death, if you did the natural cause of death where you allow him to pass on his own, then the pain medicines are an absolute must because he's going to die a painful death otherwise because his body is shutting down. The other way is euthanasia, and euthanasia can be accomplished in your home. And then you can even have the doggie's body cremated and you can have the ashes returned. $500 to $900 for the euthanasia / cremation at your house. Now here's why I favor euthanasia at home. We had a wonderful veterinarian. Her name is Dr. Keiko Miyata in Orange County, Sunnyside Mobile Veterinary. Very compassionate. She's a beautiful soul. Your dog, if you take your dog to the vet or the hospital for euthanasia, your dog is in a very stressed out situation because dogs don't like vets. Dogs don't like going to the vet. We all know that. They know there's something up about the place. Then they would be in a strange room with strange people, hearing other dogs barking, and they're now stressed even more because why are they here? And if you opt for the euthanasia in your home, you can set it up so that your doggie is comfortable. He's in the place he's used to. He just has a couple of new people there that he's probably seen before that are giving him dog treats and trying to help him out, and Dr. Miyata was very kind and very careful with Wally and very compassionate. So right away, the dog is in a comfortable environment. I can't imagine that it costs that much more. It may even cost less to have the vet come to your house. We opted for that, and we think that was the right move. When you are electing for euthanasia, this is my own pet peeve. I know people use it. I hate the term, we had to put our dog down. But I really think that it can be said a lot nicer. Euthanasia, put to sleep, but putting them down is just not a term that's something I would ever use to describe a dog. Because I'll tell you, when you are called to make that decision, understand that you're going to have to make a decision either way. You're going to make a decision not to do anything. You could do the natural causes, but with pain meds, which would be a better option than doing nothing, than allowing your dog to die on his own. Or you could do the euthanasia with the pain meds, and that, I think, even though it costs more money, is a better thing for your dog. And again, it all comes down to your economic situation. If you're in a situation where you can't afford it, then no one's passing judgment on. I'm just trying to show you options and what I thought was best, the best ideal situation. Now let's talk about when do you know is the right time? I'll tell you, you'll know. If you're paying attention to your dog, you will know. you will see the signs. And what are the signs? Loss of appetite, to the point where at the very end there will be no appetite at all. Loss of interest in drinking water. At the very end, your dog will not want to drink water. Most of the time they won't. But again, they will sometimes. But when their body is shutting down, the signal from the brain for thirst and water also gets cut off. If your dog walks into walls and then presses his head up against the wall, it's called head pressing. Cats do it too. It's a neurological malfunction. So if you see your dog walking into a wall and then pressing his head into the wall and repeatedly doing that, that's a terrible sign. The time is imminent. Your dog is already dying, okay? We noticed that Wally, for example, would go to a different area of the house where no one was sitting and hide behind computers in our office. He never does that. Dogs, they do have wolf instincts, and so they will, if they're out in the wild, or even if they live in the backyard, they will go somewhere and disappear so they can die alone. It's just what they do. Now, you'll also notice sometimes your dog is hiding, like hiding under desks or hiding in a secluded area of your house or in the bushes. Wally was doing all of that. If we open up the backyard, he would go into the bushes and lie down in the bushes. Why do they do that? Because they're vulnerable, and their instincts is that they could be attacked by predators because they can't defend themselves. So now they're going into hiding, okay? Now, if you give your doggy pain medication, you'll notice that they'll do less hiding. What you don't want is for the dog to feel abandoned and isolated, because in the pack, the worst scenario for a dog is to be abandoned, because that also means death. When I saw Wally hiding from us, he knew that we were nearby, but he was also protecting himself because of his instincts. By giving him the pain meds, we noticed that he would come and be near us, because maybe his thinking process wasn't the same, because he was not feeling any pain. So let's get to the next thing. You meet with the doctor, she gives you pain medications. How do you get pain medications in a dog? Because you might be given vitamin B supplements, you might be given mushrooms for the gastrointestinal part of it. You'll be given them, at the very end, you'll be getting prednisone again, which are small pills, and then you'll also be given that G drug that's a small capsule, but still large enough. And if you try to give it to your dog, they won't take it. So here's what I'm going to recommend. I first started bribing Wally with peanut butter. Everything was peanut butter. All his chemotherapy drugs, all of these drugs were peanut butter. And he would eat it because he wouldn't taste it. At least that's what I thought. Ultimately, the dog understood that peanut butter meant drugs, and so he shunned peanut butter. So then I tried cheese. Cheese worked for a while. And then after a while, he realized that cheese meant drugs. Maybe he tastes them. So my recommendation to you is, when you start giving him drugs, use one food until he finally gets tired of it. Don't mix both foods together, like cheese and peanut butter, or even eggs. If you do all of them simultaneously or switch off from one to the other, he'll eventually start associating all of them with drugs, and he'll stop eating all of them. So you do one sequentially until he gets tired of it. So I went from peanut butter to cheese to eggs. Eggs were wonderful to hide the medicine in, but it only lasts for so long before he gets wise to it. Next is when your dog is hitting the end of life, he's going to start losing control of his bowels. You will notice that he will let go in any situation that he normally would never do before. It's not because he wants to, it's because he can't help it. And remember, your dog is very vulnerable. Your dog is an expert at picking up on your emotions. He's going to see that he defecated in the house. He's going to worry that you're going to be upset with him. Don't be upset with him. Clean it up. Don't complain. Don't grumble. Don't show him any attitude. Pet him on the head. Kiss him on the forehead. Let him know everything is fine. Now, when your dog starts to defecate, realize that it's just part of the plan. Clean it up. What we did is we gated off part of the house so that he could only defecate on the tiles, so that we can kind of keep it controlled and it wouldn't wind up in anywhere. I mean, I one time stepped in it in the middle of the night. Wasn't expecting any dog poop to be there, but it was. So here I am hopping around. So limit the area that your dog can travel. Next, in terms of end of life, another symptom is fever. You'll notice your dog is getting hotter. As your dog gets closer to the end of his life, no matter how valiant you are, he won't take your medicine that you give him. He won't eat any food. And before you get to the point where he won't eat food, you've got to spice it up for him. I gave him spicy sausage, pepperoni, and that actually works. When your dog, his systems are shutting down, he shuns the foods he likes. But because he still has some, ability to perceive things, different spicy meats seem to really work wonders, because Wally was eating them for a while. Now people would say that's bad to feed a dog sausage and pepperoni and whatever, and I know that they're probably right, but I'm talking about a dog who doesn't have much time to live anyway. So I guess what's the point of the argument there? It's not like I have to worry about it ending his life. His life is ending now, and I'm trying to transition him to something comfortable. Here's a big trick. When your dog stops eating and drinking, I stumbled across this by accident. Get a spray bottle or one of those sports bottles with a tube on it and gently put it in his mouth. He won't like that at first. He'll kind of turn his head, but just slide it in there. I didn't want to use a squirt bottle with a point on it because I didn't want it sticking inside his mouth. I instead used a nozzle sprayer like you would if you were just spraying a window. So I went to Home Depot, got myself a bottle, put just water in it, and then I just kind of wedged it in between his mouth. Now he didn't like that, but he's biting down on the nozzle, but he's not biting me. And then I started squirting the water as a spray gently into his mouth. And at first he didn't like it, but then he immediately liked it, because now he could start swallowing water. And when it comes to the drugs, doing that meant all the difference in the world, because now there was a gap and his teeth were now separated by the nozzle. So he's got separation, and I'm looking on the side of his jaw here. I can then take a little pill and just put it right in his mouth while he's basically gulping down the water. And I'm not going quickly, I'm going slow, just spraying slowly. And then I stick it in the side of his mouth down a little bit, and he's not paying attention to that, and he swallows the medicine. So I was getting the medicine in him by using a spray bottle. Also, since his mouth was open, I could put a little bit of food in there too, but it was very soft. You can't give them anything crunchy to eat. Another sign when your dog's life is coming close to an end is even dog biscuits are too tough for them to eat. They put it in their mouth and they drop it, and then they even have trouble picking it up. If you find your dog walking in a circular pattern or off in an oblong angle and then just staggering and losing his balance, that's another sign that he's coming to the end. Our dog got to the point where he couldn't pick himself up off the floor, and then he would yelp. And it makes perfect sense, because in the wild, a dog that is trapped on the floor is vulnerable to being attacked by predators. So I would get my hands under his rib cage and I would lift him up and then stabilize him and allow him to start walking again. And wherever I could, I would open the door and allow him to go outside to relieve himself, and he would still try to do it. But near the very end, he couldn't really do that without falling over. You'll also notice something that will be very scary. You'll see that he'll start breathing very rapidly, and you'll actually see him go through his mouth. That's the body trying to get oxygen. That's the heart pumping at an accelerated rate. And then you'll see times where his heart rate will slow down to the point where he's barely breathing, and his lung is barely moving in and out. You'll also notice near the end of life that the breathing is coming deeper and closer to his rear legs from his abdomen as he's pushing his abdomen to try to make breathing and heartbeat regulation. It kind of shifts lower to the body as he's trying to maintain that. Your dog, when he's near the end of life, is going to be feverish. He's going to feel horrible. And if you leave him in his dog bed, a padded dog bed, because he's insulated and he cannot perspire like humans, and he's on a matted material that also does not ventilate, he's actually getting hotter. So you're going to have to gently take him off of his dog bed and put him on a cold floor. And you'll notice dogs doing that. They'll actually be sleeping on a cold floor, and you'll think, why is he doing that? Well, it's because it's cooling him down. He likes the feeling of that, and he may start throwing up. I made a mistake of giving him a little bit too much water through the spray bottle, and he vomited it all up right in front of me. So then I learned every few minutes, just a few more squirts, and a few more squirts, and a few more squirts. It got to the point very quickly where Wally would feel the bottle in the front of his mouth and open his mouth and take the water. It was one of those really tender moments where your heart feels so much pain for him, for your dog, because he's in such a terrible situation, and you're helping him by giving him water. Without the water, the dog is also slowly dying of thirst as well. The food is important because he'll stop eating. We found that the only way to really do this at the end was to get really kind of mushy food so that he would swallow it along with the water. You can't give him anything solid. So with the mouth open because of the water bottle, almost like oatmeal-ish kind of texture, we just put it in there so that he can digest. But it's not going to be a lot of food. If you use the medicine that your vet gives you for the pain meds, what I have found is that your doggie will be lethargic and sleepy for about 8 hours for 300 milligram, 2 tablets, 300 milligrams for about a 25 to 30 pound dog. He will be stabilized for about 8 hours with 2 of those pills. When you see him breathing through his mouth, it's because he's under stress. He needs oxygen. His heart rate is accelerated. I know I kind of talked about this, but let me just say again, he needs food, he also needs water, and he also needs to cool down. We found that it was better to have Wally on his side rather than having him sit right on top of his chest near the last few days. He seemed to be more comfortable that way. And like I said, we kept him within the circle so that he would have family members around him because he's feeling very vulnerable and he's in a terrible situation. We also staggered the family schedule so that there would be people around him and be with him. When you get to the point where you realize that your dog can't walk anymore, he can't control his bowels, he's looking at you and there's no joy in his eyes, there's no good days anymore. The days are just trying to help maintain him to keep him alive. You've reached that point, okay? There is no set time for any dog, but there is just the fact that it's going to happen. So I chose to have Wally put to sleep. When Dr. Miata did it expertly, I might add, he took his last breath after only 5 breaths. And there was no stress on him. He was peaceful. The first shot she gave him was a sedative to kind of make him feel, kind of like, let him just kind of relax, and almost like if you're on a tranquilizer. But he could still see. He could still see us. So what I did is I made sure that, he could see us the whole time. Dogs, of course, pick up on your energy, and it's a horrible time. They loved you unconditionally. You were everything to them. Their world was all about you.